Domestic violence advocacy programs are an important entry point for identifying survivor health needs and helping to link survivors and their children to needed health services, including preventative care. Health advocacy is just that. It's addressing and responding to survivor health needs within DV programs. When integrated, we know that health advocacy can significantly improve survivor health outcomes.
As a survivor, I wish that DV service providers who interacted with me at the time of my abuse had a model for health advocacy, including relationship with healthcare providers. It could have assisted me to get medical care needed in a timely manner. For this reason, it was crucial for me in my advocacy work to have created relationships with medical providers who are providing training to medical students to ensure education includes best practice working with survivors of IPV.
Our health advocacy model is to see our organization as a wellness center where our philosophy is to promote wellness and healing, not just for domestic violence survivors and their children, but also for advocates in the field. Our mission of ending domestic violence in the moment and for all time has both prevention and intervention in there, which are two of the main strategies in public health that build the case to see domestic violence as a social determinant of health. Consequently, this allows us to address health concerns within all of our services. For example, having a health intake for our shelter and crisis program that addresses reproductive health needs, support group sessions that intentionally address the impact on health, and providing community presentations that raise awareness about the intersectionality with health. Because this could be the first time that survivors hear about the impact that domestic violence can have on their health, it is important to provide health advocacy throughout services. This reminds me of two specific survivor success stories providing health advocacy. The first survivor success is when we implemented a questionnaire for our walk-in services that asked about reproductive health needs. The survivor checked off needing a pregnancy test. We were able to provide the test, and after finding out that the survivor was pregnant, an advocate was able to provide options counseling. We provided the survivor with a list of clinic partners for follow-up care. The survivor was able to schedule a doctor's appointment for an ultrasound with the support of an advocate. The second success story is when a survivor came into our shelter. The survivor listed the medications they were taking for diabetes and stated that their main medication was left behind. They expressed being concerned that their sugar level would become high. We were able to advocate with our healthcare partner to get them a prescription for a few days until they would see their primary healthcare provider.
My recommendations for DV programs to integrate and offer health advocacy for survivors is to invite them to the table for meetings, trainings, and events, and engage them in creative process of expanding services. The support you can provide with each other is essential to the journey of the survivors you're helping, and it can make a difference.
3 recommendations that I can share with domestic violence programs to start integrating health advocacy is to first assess survivor needs and services by involving them in program expansion and integration conversations. Another recommendation is to provide health advocacy throughout services and not just in one department. Lastly, provide ongoing training and discussion opportunities involving healthcare providers to increase comfort levels among advocates with the most underserved groups in mind, such as the undocumented and the LGBTQIA community.
There are so many different ways health advocacy can look, from integrating routine health assessments as part of the overall intake process, to establishing a clear referral process for making warm handoffs to a healthcare partner, to even offering shelter-based health education. Some programs host mobile healthcare vans on a monthly basis, while others co-locate a nurse on site. No matter how it looks, health advocacy is a central strategy for strengthening the safety net for DV survivors and their children, and also for improving collaboration between the health and DV fields to promote prevention, healing-centered engagement, and access to trauma-sensitive care.